talking with Jeff Fee with Providence and, of course, St. Patrick Hospital. Jeff, several weeks ago, Community Medical Center came out with a revelation that they were going to be laying off or eliminating some 60 positions, and there would be some jobs that simply wouldn't be filled, things like that. And, of course, Missoula is kind of the, if you will, the mecca in western Montana for medicine and for health care. So I wanted to find out what the picture was at St. Patrick Hospital as well.
Well, I think it's fair to characterize it's not just a picture at Community or St. Pat's. It's really an industry phenomenon. If you look out and read the papers and see the headlines, Cleveland Clinic, some large systems across the nation. There's some systems over in Washington have been making cuts. I think I forget what the statistic is. But healthcare right now, in general, is really entering into a recession, and it's entering into a period of contraction rather than expansion. A lot of that's being driven by demand, market forces with really putting a lot of pressure on our revenues. Interestingly enough, at St. Pat's, our admission volumes are actually up over prior year, but the mix of those admissions is challenging for us economically in that it's mainly medical admissions and less surgical admissions, and there's a lot more margin with surgical admissions. So, what we're seeing across the industry and what we're certainly experiencing here in Missoula is a tremendous amount of pressure on our cost structure, and that ultimately means that you have to enter into periods of austerity where you really have to look very hard at what you're doing and really get down to what your core business is, and oftentimes that does mean that jobs are impacted.
Now, have you had a chance to go through and look at what areas need to be trimmed there at St. Patrick Hospital, or is that something that you're allowed to share?
Of course we're looking at it. We're always looking at it. We're not in a position to share things. Obviously, it would not be consistent with our core value of respect and compassion to announce through the media that we're looking at doing something different without letting the individuals in those areas know. But we are looking, and we've talked very openly with our staff around some programmatic discernments that we're entering into that, as you can possibly imagine, are pretty disruptive within the staff, but at the same time they also recognize the reality of the environment that we're working in and understand that just like at home, when times get tight, you look at canceling your cable bill.
Okay. Now, does a lot of this have to do, or is it simply coincidental with the rollout of the Affordable Care Act and the various ways that is impacting people with higher deductibles and different ways of trying to find insurance, and some people finding themselves with a policy they were very happy with, getting a letter saying, "I'm sorry, you're going to have to change," and that is literally keeping them away from getting the health care that they need, at least for a while?
Well, so that revelation came out obviously within the last couple of days. So the extent of what we're experiencing, we don't necessarily see as a direct relationship to the Affordable Care Act. In fact, the Affordable Care Act, as it was written, was really a coverage expansion bill. The dynamics of what we're feeling are really industry pressures that are being driven by cuts to Medicare, cuts to Medicaid, and things that employers are doing in terms of moving, and you hit on it a minute ago, moving their employer-sponsored plans to high-deductible plans. And those high-deductible plans really do, as you alluded to, that creates a level of consumerism in healthcare that we really haven't had for some time. And so people are much more deliberate in terms of the type of services that they're accessing, especially when it's coming out of their pocket. And they're going to deal with their sore knee and just suck it up and not have it worked on if it's going to cost them significant dollars out of their pocket. So we do think that the market adoption of high deductible health plans has had a significant impact on demand.
Well, now one of the things that the Affordable Care Act is purported to do is to provide preventive services, and I know that your hospital has many departments that provide those services. So is that going to enhance and protect those departments, or are they going to be affected as well?
Interestingly enough, I don't know how to answer that question specifically, but you bring up an interesting point that we really don't know what the impact of the Affordable Care Act on the exchanges rollout next year is going to have on demand. If we see a high adoption rate, where we see a lot of the people in Montana that qualify for some level of assistance on the exchange go out and actually get insurance, and these individuals haven't been accessing health care before because they don't have insurance, we could theoretically see an uptick in demand next year that could, economically be good for the hospitals. But that is a very big unknown. Obviously, the difficulties of being able to navigate just the website itself is, trying to decide on a health plan that makes sense for your family is, those are complex obstacles to wade through. So we're not really overly optimistic that we're going to see a tremendous amount of enrollment in the exchange next year. We hope that we're wrong on that front, but in the absence of a lot of movement towards reducing the number of uninsured, I don't see that there's much relief in store for us next year.
Would there be any use in me asking you if there's some sort of a timeline when some of these announcements might be made? That I realize the public's right to know is limited, of course, with your concern for your own people. They have to come first. But will there be some timeline where we can expect to hear something out of St. Patrick Hospital regarding staff cuts or program cuts or whatever?
I've said this to my staff. I'd like to be able to say that here's a date in the future where I'm going to be able to come out and wrap it up in a nice, neat bow. And I just don't see that as happening. And what you're going to see in the industry as a whole is an iterative process. And what you're really seeing, Peter, is we're starting to see evidence of moving away from the traditional fee-for-service medicine more towards population health. And in that model, the economic engine of the current healthcare system, the hospital, plays a very, very different role. And when you start thinking about just the organizational implications of really transforming the delivery system itself, that transformation, it's almost an evolution away from the current model towards another model, is incredibly disruptive. It's, in a lot of respects, it's the right thing to do because I'd like to see an era where my leading indicator for success isn't the number of patients I have in the hospital, it's the number of patients I've been able to successfully keep out of the hospital. Mm-hmm. But if you think of the economic implications of that transition, it's going to be an iterative process over the next 2 to 3 to 4 years. So I don't really have a timeline when announcements are going to come out and stop, because I think that it's just going to be, you're going to see a lot of change in the delivery system over the years to come. So
just briefly, if you would, what is the new model as you see it?
Well, again, that's a very complex question, but certainly some of the things that we've been advocating for is, in a current fee-for-service environment, the economic incentive is to do more. The more you do, the better you do. In an accountable care organization type model, or you want to call it a managed care model or call it a capitated model, the alignment of incentives is created such that the delivery system is really incentivized to identify those that are the most at risk in our community, or the ones that are getting ready to be the most at risk, get out proactively in working with those individuals to manage their health in such a fashion that they don't develop chronic issues or acute issues that ultimately warrant a hospital stay. It's not to say that we're not going to have the need for hospitals. Certainly we will. But in most hospitals across the U.S. today, there are people sitting in our inpatient beds that have had the system itself done a better job managing their meds, for example, in the outpatient setting. We could have avoided a very expensive admission. Under the new models, the alignment of incentives create an opportunity for resources to be deployed differently, out in the community, more proactive, more outwardly facing. Today, we do a great job when patients show up and we take care of them and then send them on their way. The industry as a whole, and we certainly are part of that here in Western Montana, we don't necessarily do a good job of reaching out proactively into our community and engaging them in such a fashion where we're keeping them in the lowest cost setting and ultimately keeping them healthier. And so it's this switch from volume-driven fee-for-service towards this concept of population health.
So do you think that Missoula in itself, I know but there's some wonderful health organizations in Missoula. It's one of the reasons why people, are willing to travel here to get really good health care, whether it's heart or cancer or whatever. Do you see those that changing or continuing, or will those, especially those serious illness type of services, continue in the traditional hospital sense?
Well, there's certainly, we see migration just through improvements in pharmaceuticals and technology, being able to do more and more in the outpatient setting. We have a deep commitment to maintaining our tertiary care infrastructure. We are very fortunate to have some very, very high-quality healthcare professionals that's really unique for the size of town that we have.
Right.
And that's one of the things that we fully anticipate and fully intend on protecting. So yes, to that end, I have a personal and selfish interest to keep trauma up, very viable and very healthy, because I like going downhill very fast on skis and mountain bikes, and someday I know I'm going to need them. So yeah, there is a level of infrastructure that we absolutely have to protect, and we certainly intend on doing that.